Tonight, from Kelloland Media Group, a HealthBeat Special, Coronavirus Research.
Good evening, I'm Sophie Heineman. Thanks for joining us for tonight's HealthBeat Special. Over the next half hour, we're going to look at the research being done here in Kelloland to better understand the COVID-19 pandemic. We'll talk with the president of research at Stanford Health, Dr. David Pierce, about what researchers are working on right now, how the research has changed over the last few months, and what needs to happen to bring about a vaccine. We'll also show you how testing could soon change for COVID-19 as the flu season starts up. Plus, we talk with someone who survived the virus and is now taking part in Stanford Health's COVID-19 registry. But first, we want to get an update on the latest developments with the pandemic. Joining us now via Zoom is Dr. Joshua Crabtree, the Vice President of Sanford Clinics. Thank you for joining us.
Thank you for having me.
So we'll start off with South Dakota continues to see a spike in COVID-19 cases. Mayor Paul Tenhaken recently required city workers in Sioux Falls to wear masks and urged people across the region to do more to slow the spread. So why are we seeing such an increase, and what do people need to do to slow the spread?
Well, I think it's important to remember that this time of year, we would normally see an increase in certain infections anyway. This would be a time when people are getting back to school, they're getting involved in more indoor activities. So we typically would see a increase in activity. COVID, I don't think, is any different. It acts very similar to a lot of respiratory viruses. So seeing an increase now as we see more widespread community spread is not necessarily surprising. I think what we need to continue to do is take seriously the efforts of masking and social distancing and hand washing and hygiene and protecting ourselves like we've been talking about since really March or April. I think we know over the last 6 months that those things are effective. And when we take them seriously and we do them consistently, we can definitely slow the spread.
And after President Donald Trump was diagnosed with COVID-19, he was given several treatments to help with his recovery. So are similar treatments available here, especially if someone is hospitalized?
Yeah, absolutely. We have been very, shall I say, taking an offensive approach to treatment and how we can best serve the members of our community. If a patient is hospitalized, they have access to the antibody treatments that President Trump spoke about. We have access to antiviral medications. We utilize steroids and high-flow oxygen, and our clinicians have gotten significantly more capable and more smart about how we are treating this virus. Our ventilator rate, or the rate with which we're putting people on ventilators, has decreased because what we found is that isn't necessarily the best way to treat all patients with COVID when they start to get more acutely ill. I have to give our providers credit in their efforts to try and advance our knowledge base and improve the opportunities that our patients have when they come and are hospitalized in our health system.
And so how are we doing on testing people for coronavirus, and are there enough tests?
It's a great question. We have been working diligently since March of this year to try and increase our testing capacity, whether that's partnering with outside resources or attaining or gaining additional analyzers, additional equipment that we can use. We've been very aggressive around that. And to date, we're able to run about 2,700 tests a day on average. And our average turnaround time is between 2 and 3 days, depending on the volumes. We have seen volumes kind of wax and wane over the last several weeks, and we're in kind of an increase or an uptick of those volumes now. And as volumes go up, our turnaround times do slow down a bit, but our lab staff have been great at doing everything they can to try and keep those turnaround times to a minimum.
How are the hospitals doing on capacity to treat both COVID-19 patients and patients with other medical issues?
Well, our hospitals are busy. I think we're no different than any other hospital in the country, or certainly in our region. We're taking every opportunity to be innovative and creative in how we can make sure that we're available as a health system to take care of the patients in our community. Our community relies on our health systems, and they need to know that we're here in their time of need, and we are. If a patient is needing, or if a resident is needing emergency care, they will get it immediately. Because of the increased volumes, not just with COVID, but with other health issues, we may see patients with less urgent needs. They may have a little bit of a delay or have to wait a few hours in an effort to get into a traditional space where they may be receiving care. I think we're seeing some manifestations of maybe delayed care that didn't get done, or when patients were concerned about coming into our clinics or coming into our facilities 3 and 6 months ago. That's not to point fingers at anybody. That's just a fact of what's happened. And now we're seeing some uptick in other healthcare needs besides COVID. COVID is right now taking COVID patients, or patients with COVID are taking up about 15% of our beds in our medical center right now. We have been working diligently with our network facilities, so facilities in our outside communities in South Dakota and Minnesota. They've been great partners to help patients keep their care close to home. For those less acutely ill patients that are able to stay in other hospitals, they're doing that, and that's an appropriate use of those resources. But if they're acutely ill and they need to be transferred to the medical center here in Sioux Falls, we're making every effort to make that possible.
All right, and lastly, Halloween's coming up soon, so tell me really quick here some ways that are safe to celebrate the holiday.
Well, I think what we've seen is that it's important for us as humans to be able to celebrate together, to socialize together to the best of our ability. I think we can, one of the benefits of Halloween is that it tends to be a outdoor activity to the best of our ability. I think we know that outdoors is a little less risky than being indoors, but still we need to continue to follow those tried and true practices that we know improve things. So that means distance when possible. When we can't distance, make sure that we're wearing a mask. When we are able to, we need to be practicing good hand hygiene. And remember that our community members, as community members, we need to rely on each other to make good decisions about where we're gathering and where we're not.
All right. Thank you so much for your time, Dr. Crabtree. And coming up after the break, we're talking with Sanford Research President Dr. David Pierce about the research being done here in KELOLAND concerning the coronavirus. We're back right after this.